Hello, we are showing you this informational video because you are eligible for a clinical trial. You are eligible for this trial because you have multiple severely broken ribs and have been admitted to the hospital for this reason. My name is Dr. Thomas White and I'm one of the lead investigators for this trial. I'd like to take the next few minutes to explain why you may want to consider participation. In the not too distant past, all patients with rib fractures were treated without surgery. The treatment consisted of pain medication and in severe cases a breathing tube and machine. Many patients with severe injuries developed complications such as pneumonia, chronic pain, and chronic breathing difficulties. Over the last 10 to 15 years, an operation has been developed to place small permanent plates on the rib fractures to stabilize them, promote healing, and decrease pain, similar to other bone fractures. Myself, as well as the investigators of this trial, have helped to develop this treatment, known as surgical stabilization of rib fractures. This operation using titanium plates and screws has been proven, as compared to no surgery, to decrease pain and complications and quicken recovery. Also, the surgery has been found to be extremely safe with a very low risk of complications. Titanium plates and screws are quite expensive, however, limiting their usage in some locations. This has led surgeons and engineers to design a new type of plate system that is made from polyethylethyl ketone, or PEEK, a plastic-like material. This type of material is already widely used for other types of internal implants. This style of prosthetic rib plate has been inserted in dozens of patients in Uruguay. What we still do not know, however, and are attempting to find out with this trial, is whether this PEEK product and the care necessary before, during, and after surgery is feasible, safe, and effective for patients with severe chest wall injury. This current trial, named CWIS PRESS trial, is being conducted by the Chest Wall Injury Society, an international organization of experts in treating rib fractures. There are several centers like yours enrolling patients in this trial across Central and South America with an ultimate target of 100 patients. If you join the study, you will undergo an operation that will take approximately 2 hours. While you're asleep, expert surgeons will place PEEK plates onto your broken ribs through an incision, stabilizing the fractures. This type of operation has been performed in thousands of patients across the world using titanium plates and screws. Surgeons at your center have been well trained to perform these operations. In fact, one of the criteria for selection for surgeons and sites in this trial is their expertise with this surgery. Your care team will follow you for at least 2 months after your injury and surgery. We will need to collect basic information about your treatment, the progress of your healing, and recovery. This study involves both risks and benefits, and you should speak with your surgeon to discuss these fully. The study investigators are not being paid to participate in this trial and have no vested interest in any particular outcome of the trial other than to advance the care of patients with rib fractures. This trial is being funded by the Chest Wall Injury Society and the individual study sites. You should know that participation in this trial is completely voluntary, and if you decide to join, you can remove yourself from the study at any time without consequence. I encourage you to ask your surgeon any additional questions that you may have about the trial. Thank you for taking the time to listen to this message, and please take a moment to think about how your involvement in this trial will be a valuable contribution to the betterment of medical care everywhere. On behalf of all of our study personnel, I wish you a speedy recovery from your injuries, and I appreciate your consideration of participating in this important study.